Welcome everyone to our Path Tuesday Table Talk, Patient Advocates Transforming Healthcare. My name is Hala Dura. I'm the founder of Patient Advocates Transforming Healthcare. I am also a patient family engagement consultant, based in the Washington, D.C. metro area. I'm happy to welcome our audience back to our fall season of the Path Tuesday Table Talk, which happens every Tuesday at 2 p.m. Eastern. And I'm super excited to have Dr. Katie Boston-Leary joining me today for our, what I think is a really critically important topic, patient family-centered care and the loss of human connection during the time of COVID-19. Dr. Boston-Leary is a chief nursing officer. She previously was at University of Maryland, Capital Region. She's also an adjunct professor of nursing and serves as a consultant at the American Nursing Association. She's a nationally and internationally recognized speaker, and I'm really excited to have her today to really open up this topic for us, because we know that this has been such a critical time for patients, families, and loved ones during COVID. And we most certainly know about the lack of family presence due to the infection control precautions due to COVID. And we know that that has taken such a great toll on so many communities, particularly many of those who serve as caretakers to their loved ones, or those who cannot communicate with their care team in these times. And really having that deep separation with their loved ones has obviously caused a lot of pain and trauma to many families. As well as it's been a great juggle for our wonderful physicians, nurses, and other care team providers in trying to provide compassionate care while also recognizing the challenges of infection control that COVID-19 presents. So I'm really excited to have Katie speak with us today about some of the issues she's seen around this and how best we may look at practices to really support patient family-centered care during this pandemic, and obviously during a time that's like no other. So Katie, thank you for joining us today. Love to hear a little bit about your thoughts about this subject, and where can we go from here?
Yeah, so Hala, thanks for having me. And I really want to say it's an honor to be on your program. And as you know, I've been a fan of yours for some time now. So, and we've connected over the years. So it's really nice to see you again, and definitely appreciate being a part of this very important topic. So in terms of where we are with COVID, and everyone knows that the pandemic still persists. Over 190,000 Americans dead. Cases seem to be at a lull at some point after spikes, but we're starting to see, well, there's an expectation that we'll see some spikes again, and I believe 22 states are, we're seeing spikes before the holiday, and the concern is that it will be worse because people gather around the holidays. So during that time, since, in these times with everything that's going on, of course, as you know, most hospitals and healthcare institutions still have their no visitor policies in effect, and which has created these tensions around, not being able to be there for your loved one the way you would like to, and which of course impacts the healing process. And you do have the situations which vary from the relatively short stays in the stints in the hospital or healthcare institution, where you're there for an episodic or a small period of time for something that is manageable outside of that physical setting. But then you have on the other end of the spectrum, long-term care facilities where you have a lot of patients and people who are sequestered for months, since, in some cases, since the pandemic began, and they have not been able to connect with their loved ones in person. And you wonder about the impact that that is having on their, not on them psychologically, but physically as well. So patient experience is important for a reason, right? You know, there's a clear impact that that has on the ability to truly partner in your loved one's care, and them being a part of the healthcare team. And yes, even though the ability is still there for connections to be made electronically, there's still something lost, and there's nothing to replace the human connection. And even with even though some of that is being substituted by caretakers or caregivers at the bedside, they're still in masks and gowns and everything else, so that takes away too. So it's a very difficult time for anyone seeking healthcare today, no matter where they are, and no matter what type of care you need. It's very challenging, and it's not something that I can imagine experiencing and dealing with. So that's my long response to your question.
Thank you. Yeah, I mean, it's quite a challenge. I think it's one of those questions that is really hard to address because there's so many considerations to take into account in terms of protecting loved ones, but at the
Yes.
same time embracing and nurturing that connection that people, of course, want to have when their loved one is sick or perhaps having a procedure or surgery or any type of treatments. I mean, we've read about the many cancer patients now who typically would have someone at their side for their chemotherapy, and they're no longer able to do that. People who are going in for procedures and surgeries, whether it's same day or with an inpatient stay, who also aren't obviously allowed to be with their loved ones. Um, and then we have, some of the other challenges that this presents, for many families who may have, for example, language barriers, not having their loved one with them who may be that person who provides that role for them has been challenging. Those who are nonverbal and not having their caretakers there is also quite challenging. And I think much of this discussion has also been around disparities in health equity. And we know for many of us who come from communities of color, minority communities, vulnerable, marginalized populations, the importance of having someone with you, whether it's, for a procedure or whether it's for an inpatient stay is so important. So I wonder, as someone who's a leader, nursing leader, and we know nurses are doing such a wonderful job really trying to support everyone in the best way they can. How has that challenge really been absorbed? How are nurses really able to still do the work that they always have been committed to do, but at the same time knowing that there's that disconnect, and how does that impact them in their daily work as well in their lives?
I'll say nurses have really done a lot of innovative things to fill that gap. You find that stories of nurses that willingly just stepped into that spot or that place on their own, using their own devices to connect their loved ones with their family members or patients with their family members. You find there are also stories about with patients that passed away where family members are seeking feedback or insight from nurses to understand what were their last words, how did they suffer, did they say anything else when I wasn't there, and nurses are gladly filling in those gaps for families who have not been able to be there during those last minutes, and those are the extreme circumstances. Currently, you do see, and I'll use long-term care as an example. Well, I'll start with acute care. The devices that are being used, iPods, tablets, and what have you, has really helped. Hasn't replaced, but helped the situation where nurses are more than willing to make those connections, not just when the patient requests it, but when they see that it is needed. they would facilitate making those electronic connections for patients. And then you find on the other end, you in long-term care, you see a lot of creative things because these are patients or are elderly that are going for months on end without seeing their loved ones. In some cases, husbands and wives who've been married for decades, all of a sudden separated where they can't see each other. So I saw a story where a nursing home created a curtain, if you will, a plastic curtain, so they could actually be hugging around using the curtain as a barrier. Visiting stations with plexiglass where they'll have patients come out and their loved ones will come in view and have a conversation and sit face to face. A lot of creative things are happening, and a lot of those creative approaches are initiated and created by nurses, which is really has been heartwarming and fantastic because in some respects the belief was prior to COVID, these connections were taken for granted. In some cases, they weren't necessarily respected consistently. And now you're seeing this overabundance of effort to really make sure that these connections are being made because it's evident that this is a gap. And very creative, innovative, unconventional approaches are being taken to make those connections, for those conversations to be had, for those eyeball to eyeball views in person that are happening. And as you said, Hala, there has to be respect, of course, for why things are the way they are. But at the same time, it doesn't mean that we accept it as it is, right? We continue to look for ways to make sure those connections are being made. And the appreciation for patients at the end of their stays for really a lot of nurses taking those approaches on their backs and really making those connections have been really appreciated. So, those are the stories that we're hearing, and it's heartwarming to see that. It's because there's an appreciation for the importance of those connections being made.
Yeah, absolutely. I mean, it's really been heartwarming to read a lot of those stories in the media and from colleagues who share them. And I can see how much love and really compassion is going into trying to come up with innovative solutions. I wonder, we know that patient family centered care in terms of, maybe health systems who have patient family advisory councils or have patients and family members that sit on boards has also been impacted during this time. And some have tried to switch over to virtual, but we also know that virtual doesn't necessarily mean that everyone is able to have that type of access, to the virtual platforms, whether it's because of technology or lack of internet. So I guess I'm wondering, what are you hearing and what are you seeing in terms of innovative approaches to keep that patient family advisor or voice in these discussions as we look ahead and as we move forward? How do we embrace that voice? And are there innovative approaches that you've heard about that perhaps we could share with our audience as well?
So we've heard that there are some instances and stories that we've heard where patient family advisory councils are still being held. They're just being held virtually, which is great because we certainly don't want those to stop. And what better time or more important of a time for those councils to be held or those meetings to be held? It's now because hearing from the community about how the impact of these policies that again are in place for a reason, and the impact that that's having, and what additional steps can be taken to engage families is important. And so there are cases that I've heard where virtual meetings are still being held, And I've also heard that in some cases, for some institutions that did not have them, they instituted them during this time because of that need to hear what the community is feeling and saying. Because and I know patient satisfaction is the main driver and metric that a lot of institutions pay attention to. And there's a recognition, of course, that that will be impacted because of these policies. Because it's not just being there to hold my mom's hand, and being at the bedside for her to see me. It's also me being able to contribute as part of the healthcare team, and not just when it's needed on that end. If I have a thought or something that I feel that should be shared about what my mom needs, I want to be able to initiate that from my end too. And also be there for critical parts of my mom's care. So I've really seen and have been overjoyed to see that in some cases where there wasn't a PFAC or Patient Family Advisory Council, those have been instituted during this time. And I think someone mentioned the term in crisis. Sometimes you find gifts of devastation. The gift of devastation in this case is really underscored and undergirded the importance of um, these really tapping into what the community is saying, feeling, seeing, hearing, for how we can be better for our patients. Because historically, the old traditional means, we felt that we were the experts and we knew what needed to be done. Now there's a recognition in the contemporary sense that no, it's not just about the medical providers and the clinical and the clinicians that are at the bedside. The patients that needs to be involved too. Their loved ones need to be involved too. And families not just defined by blood. It's whoever the patient says is their family. And a lot of those policies have been done away with. And so you're seeing this reemergence of not just along the lines of visitation, but through and through a lot of things that they're doing to make sure that patients are aware that there is caring that still exists. We're going to manage your health, but caring is and compassion is still important. So you hear examples of when someone's being discharged after a bout with COVID, with the virus. They'll play a certain song, which lifts everyone, not just other patients, but the caregivers have to provide care as well. You see the appreciation lines that are being set up when patients are being discharged with, the clapping, the bell ringing, everything else. So the key thing, Hala, for me is for a lot of things that we've done that we've never done before in this setting, that shows compassion, that shows caring, empathy, and all those key pieces. How do we sustain those things, right? To make sure that, well, this was only during unprecedented times and it was part of our crisis standards of care. How do we continue to show we care moving forward, and not slide back to where we were prior to COVID? Of course, families eventually will be coming back in to the healthcare setting to be there with their loved ones. But again, that doesn't replace some of the things that have been taking place by a lot of clinicians and healthcare providers to really show that compassion. So that, for me, is my main takeaway from this time, is that uh, that push, that ingenuity, the innovation, all the things that are being done right now to not just about address health, but address caring. Those things continue as we move in a different phase, hopefully soon, with this pandemic.
Thank you. Yeah. Yes, hopefully soon. I do hope we move towards a better phase. We did get a question in our chat that I thought was really especially relevant to some of the last points you just made. And I do want to remind our audience, if you are signed into YouTube, you are able to share some questions in our chat box. So please feel free to send those in. You talked about, sustainability and how do we sustain this after, we get through this pandemic. And you talked a lot about also, showing caring and compassion. And I think, that's also a two-way street. And so I believe, we have to show compassion for one another. And this question really speaks to that. What are some of the ways, nurses are taking care of themselves so they can take care of patients? And more importantly, how can patients or patient advisors who serve on, patient family advisory councils support nurses? Because I can only, imagine that the immense pain, stress, and trauma that, you know, nurses, physicians, and other care team providers and support staff are experiencing during this as well. It certainly is not, will not, and cannot be easy. So, how have you heard, maybe also health systems supporting, their nurses and their staff, and how can we in the patient family engagement community really also help support those efforts?
Yeah, great question. So definitely very important. And nurses, and this is again, talk about unprecedented. So usually you have situations that put you in crises, and it's for a shorter periods of time, like natural disasters, even in some cases, plant events that, with the physical plant that will cause maybe flooding or what have you internally and things like that. This is unprecedented where it's gone on for such a long period of time. And there's a fear that even if you've had your turn with the virus, where you've had your surge, is the likelihood that it could come right back, especially with everything that's going on with not having a national mandate around how to manage the virus, where we could be where a lot of other European countries are right now. So there's so much variability. So the risk is still there. The vulnerability is still there. And everyone's guarded because of that. So yes, nurses have, the numbers are clear. I think over 1,000 healthcare workers have died related to the virus, and most of them are people of color. We've also seen data to indicate that a lot of nurses that are suffering or struggling financially are nurses of color. So a lot of what we're seeing that's playing out and is socially, nurses are not immune. So nurses that are supposed to take care of patients also we're seeing the same numbers and statistics play out with nurses as well. So yes, there is a need for nurses to really focus on self-care. And there's a lot in the literature about resiliency, where it's really having some elasticity around how to deal with the stressors and being able to manage through. I've really been putting forward a message more around thriving, and realizing that you can do well in spite of. And maybe after you go through a crisis like this, you're not going to come out of this if it's the same. Because if anyone that's been through a crisis knows, well, on the other end, you're a different person. You're never the person you were prior to. So recognizing that, what do you build on? What do you look forward to? How do you progress? And in some cases, even be better. So you see a lot of nurses, and we did some interviews recently, and it's really a good, really, really encouraging to hear nurses are engaging in a lot of physical activity more than before. A lot of nurses have changed the way they eat, their diet. They've really thought about how they want to, improve their energy. So they're changing their diet to more vegetables, having the proper balance. Um, Physical activity, very much so. I think I mentioned that where we're seeing a lot of nurses lose weight because they recommit to what they need to do, and things that they put off to be healthier, they're doing now. And then lastly, I'm hearing a lot of nurses are using apps that help with their state of mind and helps with reducing stress and also improving sleep, because that was another concerning number coming prior to COVID for nurses. And you can imagine now with COVID's in place, a lot of nurses that were at the front lines working with their colleagues, they felt the need to um, forego a lot of what they need to do to take care of themselves, and they wanted to be there for their patients. So it's encouraging to see that a lot of steps are being taken by nurses. They're seizing the opportunity to now take care of themselves, because I think part of what the dynamic that's playing out is, they're seeing patients come in, with the virus very early in the disease and seeing them pass away. Those things impact you, right? You think about how fragile life is. We all go through that when we lose a loved one. And I recently lost someone, not due to the coronavirus, but the weird, odd thing is that she was so afraid of the virus, she won't let anyone visit her home. And now she actually ended up dying because she had a aortic dissection that was sudden, and she passed away. But when you go through something like that, you think about yourself, right? In terms of one day someone's here and the next someone's gone. What do I need to do differently? So I think that's hit home with a lot of nurses, and they're really taking the effort to extra steps, if you will, to take care of themselves. What can patients and families do? I think the recognition that was there prior to COVID, that meant so much, should continue. If you have someone that took care of you, that gave you exemplary care, that showed that treated you with respect and dignity and respect, and really took the time to learn about what you need and address those needs, by all means, recognize them. Those are the things that mean so much, because they don't come that often. So that means a lot for a nurse. If and I know, and from my past experience, we would get more negative, not more negative, but people human behavior. You quickly receive feedback when things don't go so well. But when things go well, yeah, it's supposed to happen. So, and absolutely, everyone's supposed to receive great care, but um, when you can, writing a letter, dropping a note, sending an email, sending a card means so much, and it doesn't cost much. And those are the things that nurses need. That's a tonic for a tough situation.
Thank you, Katie. I think, this pandemic, while so much of it is really marred by so much sadness and confusion and devastation and upheaval, I think the other side of that is, the recognition of grace and compassion for one another, and understanding that, we are all part of the same team, and we all want to support one another, and trying to find ways to do that. I think whether it's a small gesture or a large gesture or anything in between, I think has really been highlighted during this. And I do hope that those are the things we learn from, and we can sustain those even when we hopefully get through this very difficult and trying time for our country and our world. But on behalf of, patient advocates transforming healthcare, we want to thank all the nurses, all the care providers who we know are really up against enormous challenges. And we also want to say we are here to partner with you as well. And so I hope, as we look ahead and as we work towards solutions and even plans for the future, because the sad reality is there could be another pandemic at some other point in time, having those co-created solutions as community partners, I think is going to be, so important. And as we look at patient family centered care ahead, is also going to be vitally important. So thank you so much for joining me today. I really appreciate it. I hope we can connect again, maybe in another few months, and see where we are. Let's pray that hopefully we are in a better place, and we can start talking about people being back with their loved ones, and hopefully stress levels and crisis mode being much less than where we're at now. So open invitation anytime. I also want to thank our audience for joining us, and thanks again, Katie, for kicking off our fall season. We're looking forward to a lot of different topics and guests this season, so please stay tuned every Tuesday at 2 p.m. for our Tuesday Table Talks, always on our YouTube Path channel, which you can find on LinkedIn and on Twitter. And we look forward to seeing everyone next week. Our topic next week will be patients who are involved in research and their partnership, and hopefully moving the needle forward as we look ahead. So we hope to see you guys next week. If you aren't able to join us, our talks live here on the YouTube channel, so you can always come back and check us out when you're taking your evening stroll, or you're cleaning up the kitchen, or whatever that may be for those 30 minutes you'd like to check us out. Thank you so much. Katie, if you could just pause with me for a few seconds on mute as we close our stream, and we'll see everyone next week. Thank you so much, everyone.